The Lincoln-Lancaster Health Department is warning everyone of a new tranquilizer drug spreading across the country.
They say it's often mixed with other substances, increasing the risk of overdose. Channel 8's Matthew Mittleider has more.
The Lincoln-Lancaster County Health Department is asking the public to learn more about the dangers of xylazine. They're working with the Lincoln Police and other local organizations to spread the word about the animal tranquilizer before it gets to the Midwest. The DEA says it's often mixed with fentanyl and other drugs like cocaine or heroin to amplify and prolong the user's high. David Hum with the Health Department says xylazine is not approved for people and can cause a fatal overdose similar to fentanyl when combined with other drugs.
Xylazine, actually, it's a tranquilizer used in animals, so it's not for human use. You know, it's a sedative, so the reaction, obviously, people usually lose consciousness if there's excess amounts.
Hum also says with continued use over time, the drug can also lead to open wounds and ulcers on the skin. And while xylazine hasn't been seen very often in the Lincoln area, the health department is trying to get ahead of the drug's potential growth. They say a similar trend happened with fentanyl and opioids, which started small but led to thousands of overdose deaths in the last 20 years. Ryan-Curruthers with Centerpoint says anyone with an addiction should not be afraid to reach out for help and call 911 if someone is ODing.
If someone is dealing with a family member, friend, or loved one that is at risk of an overdose, then go ahead and reach out to our crisis response team. We know that treatment does work and that it is available in the community at Centerpoint and other locations.
Officials say while counteracting drugs such as Narcan won't stop an overdose on xylazine, there's no harm in using it just in case a drug has been mixed with fentanyl or other opioids.
Drug dealers and others are trying to cut the drug to make it cheaper. So we want to be sure still have Narcan on hand and administer Narcan because it's unknown what someone's having an overdose with.
Over the last 2 years, Nebraska has only seen 4 cases of fatal overdoses involving xylazine, but authorities say it's important to be aware of these drugs and their effects. Reporting in Lincoln, Matthew Mittleider, Channel 8 News.